I'm Paul Golby, I'm Chief Executive of E.ON in the UK. I think most people know us as one of the large energy companies in the UK. We employ about 15,000 people in very diverse roles. So we have lots of people, of course, in our call centres. We have people who are fixing meters in individual people's homes or fitting insulation or solar panels, for example. We have other people who are working in our big power stations around the country, and people offshore with our wind farms. So you can see a very diverse range of roles, each of them bringing their own sort of health and safety perspective. Well, health and safety is deeply embedded in our culture. We have something we call Rule 1, we don't hurt people, and that's the mantra of the business for many years. Rule 1 is the first rule. And we apply that at our monthly board meetings, for example. Health and safety is the first topic. It takes us about an hour. And each managing director of the subsidiaries has to talk through the statistics for his business, the initiatives he's taking, and what the results of those initiatives are. In this particular instance, we took occupational health, if you like, out of the surgery and into the workplace. I think people are always reluctant to go to an occupational health centre, but on this occasion we took it out of the centre, we took it into the business, into line managers, and it really produced a significant benefit and real hard bottom line savings. As a result of this, we probably saved the company about £12 million a year. So it's the right thing to do, but there's an economic benefit as well. I think it just brought the whole subject of health right up the agenda, and of course with an ageing workforce and with the demographics of the UK, keeping our people healthy for longer is actually a key business benefit.
I'm Steve Pashley, I'm the Director of Human Resources here at Leeds Metropolitan. We're one of the country's larger universities. We've got about 30,000 students and about 3,000 staff. We've got two campuses, one based in the centre of Leeds and the other based up here in Headingley. Well, it has a bit of a history to it in that 3 or 4 years ago there were some concerns expressed by staff and the trade unions about our approach to well-being. There were some concerns about bullying and harassment and issues like that. And the approach that we took was that we worked with the health and safety executive who came in and looked at all our processes, and following that they made some recommendations that we could improve our systems and our procedures for particularly dealing with stress in the workplace. We invested quite significantly in safety, health and well-being. We got a new appointment in John Hamilton, who became our sort of new head of safety, health and well-being. And through John, we invested quite a lot of time in revising our approach to stress in the workplace and well-being more generally. So we introduced new procedures, we consulted with our trade unions, and following that we introduced quite significant training programs for all our senior managers. We trained about 450 senior staff over a period of about 12 months in our new approach to stress in the workplace. And we also introduced a new wellbeing website that sort of pulled all our disparate approaches together and made a very public statement into how we were going to be approaching this in future. I think it was successful on a number of counts. I think it certainly improved our practice into how we were dealing with stress in the workplace. I think our managers became more competent and more confident in dealing with such issues. I think it helped our staff see that we were very visibly taking these sort of issues seriously, and we did care about our staff. We think it's something in the order of about £75,000 in terms of time off that we're saving with people not being absent through stress at work and other related problems. But I think more than that, we're also actually gaining a bit of income through our ability to interest other organisations in what we've done in developing a wellbeing website. And John and colleagues again have been quite successful in getting other people to take our website on, put their own branding on it, and obviously we get a fee and get some income from selling that.
I'm Jeff Green, Area Operations Director for British Gas. We're a part of the Centrica Group. We're a major supplier of energy, electricity and gas to people's homes. The section I work on is the service and repair section, which install and repair and maintain gas appliances and systems throughout the UK. We looked at some data and our road risk was increasing, our accidents were increasing. We had no real robust processes for reviewing engineers. We had never reviewed engineers on normal blameworthy accidents. We took every driver that was on the books and we applied a points score against each of those drivers. We then took the trade union through what we were doing because they're a big part of the driver reviews. And then I trialled it in London, and we looked at the highest risk drivers that we had, and I had drivers that accumulated 25 points and more, because driving in London, one of the busiest parts of the world, and we got one of the biggest fleets in the UK. We had to do something about it, and so we decided that we now know who they are. We've got their previous 2 years driving record to review them on, and that's how we kicked it off. The results have been very good. We've moved a high number of engineers. I mean, I've reviewed over 40 now. We reviewed a high number that have dropped down into low risk, and we've not reviewed any engineers and then had to review them again because they've repeat offended. And it's helped get the message out there that we are very, very serious about road safety. And if you review one engineer in a team of 12, very soon that team of 12 all know what it's about. And I think it's just raised the awareness of that this is serious and we intend to do something about it. Well, in pure financial terms, it's probably around about £500,000 a year on accident cost. And we kicked this off in 2006. And so, you can do the numbers yourself. It's in excess of £2 million. For me, the big saving is the drive in behaviour to get to an advanced safety culture across the whole of British Gas, which is what we're just part of our safety agenda on technical and personal and road safety. It just underpins the whole programme.